And definitely, then you evaluate for the sperm, you will evaluate semen, you will evaluate egg by the detection of ovulation, you will check for the ovarian reserve, tubes should be checked for the patency, and endometrial cavity should also be evaluated. And the last one is the preconception counseling and laboratory testing. Next. Next, please. Now, how you will take the medical history of the female partner. Few things are very important when you are taking the female history. The first one is the duration of infertility. It is very, very relevant. The longer the duration of the infertility, longer you might find the problem. You need to take the sexual history of the patient. Noting the frequency and timing of the sexual intercourse. This is very relevant because sometimes patient is having very infrequent intercourse and it is not falling on the days of the ovulation. And that might be the reason for the infertility, especially in those couple who are not living together. They might have very infrequent and intercourse which is not at the time of the ovulation that can lead to the infertility. Prior infertility evaluation and the treatment should be noted. This is important because once the patient is coming to you, you need to know what has been happened before, how much she was evaluated, and what treatment is given to her. If she was pregnant anytime, you need to take the history of the complete that conception, whether it was end up in miscarriage, it was a full-term baby, and what happened to that pregnancy. Gynecological history is very important because this will tell you whether the patient is ovulating or not, the menstrual history pattern, and the presence of the menstrual cramps. Usually these things tell you that the patient is ovulating because patient with the normal ovulatory cycle, they might have the premenstrual symptoms. And history of that can tell you that the patient is ovulating normally. That is the breast tenderness. She might tell you the time when she's having the thin watery discharge in the middle of the cycle. She might tell you that she's having little abdominal pain in the middle of the cycle. These are all the symptoms which are suggestive of the ovulatory cycles. You need to know the history of the sexually transmitted infection because the sexually transmitted infection like the gonorrhea and the chlamydia, they are the main cause for the tubal blockage. And if the patient is giving history of the frequent and the recurrent vaginal discharge, she might be a candidate of this sexually transmitted disease that can lead to the blockage of the tube. If she is having a pelvic surgery before on any part of the genital tract like cervix, might be dilatation of the cervix or some treatment of the cervix, uterus, ovaries, or the appendix is also important because sometimes when the patient is operated for the appendicular mass, it might cause adhesions later on and lead to the blockage of the tube. So you need to know the complete gynecological history of the lady in evaluation of the patient. You also need to know medical and the surgical history. I have already explained in the above few discussion. Medication and the social habits are important. Medication, sometimes the patient is taking, if she has taken chemotherapy, maybe a few years back, or the cancer treatment, that can lead to the premature ovarian failure. That can be the reason for her infertility. The social habits, use of the alcohol, smoking, they are also relevant in case of the infertility evaluation. You need to know the family history of infertility. If there is history of infertility in her sisters or other family members, age of the menopause in her mother or in the other sisters, and sometimes genetic disease you need to know, which can lead to the infertility. Coital frequency and sexual dysfunction, we have already discussed that it is very relevant and sometimes can be the reason for infertility. Next, please.